Teresa Freed with Johnson County Government. It's our goal to stop the spread of COVID-19 in our community. We also want to make sure you have the latest information on our efforts. For data on how COVID-19 is impacting the county, visit our dashboard on jocogov.org.
Hi, I'm Elizabeth Holzschuh, the Director of Epidemiology with the Johnson County Department of Health and Environment. We are very excited to announce that we are starting to vaccinate 12 to 15-year-olds with the Pfizer vaccine starting today, following the FDA's authorization as well as the ACIP, the Advisory Committee on Immunization Practices recommendations, and CDC. This is an important step because as we are able to vaccinate more and more of our residents against COVID-19, the closer we are to getting back to normal. In particular, when people are fully vaccinated, meaning they've had both of their doses and they're 2 weeks out from that second dose, that means that if they are exposed to COVID-19, they don't need to quarantine. And so as kids move into summer and doing athletics and going into the fall for school, this is going to be really critical to keeping our schools functioning and keeping kids involved in their activities. I know that there are a lot of fears around COVID-19, but please rest assured that there were no shortcuts taken in authorizing this vaccine. Most of the time, what we see when vaccines are rolled out and they're doing their clinical trials, they do all of the steps in a linear fashion. They do step A, followed by B, C, D, and E. But what Operation Warp Speed did was take away some of those restrictions and allowed the pharmaceutical companies to do, say, steps A, B, and E all at the same time. And so it sort of overlapped it, really just condensing that timeline, but still doing all of the required collection of data, testing during clinical trials to ensure that the vaccine is safe and effective. Furthermore, we know that we have vaccinated over 100 million people with Pfizer vaccine since the beginning of the pandemic, and that's just in this country. Other countries around the world have also been vaccinating people with the Pfizer vaccine as well as the other vaccines that we offer. What we have seen is incredibly high levels of efficacy, meaning that people who are exposed do not develop severe symptoms, and most of them don't develop any symptoms at all, even if they're exposed to COVID-19. I know that there are some other concerns about fertility and puberty and hormones. There is absolutely no evidence to support that this is a risk with the Pfizer vaccine. During the clinical trials, there were a number of participants who received the vaccine who also got pregnant. Also, when it comes to the actual biological mechanism, how these vaccines work, there is no reason to believe that there is going to be any effect on hormone production or puberty or fertility. If you're interested in getting your COVID-19 vaccine through the county health department, you can go to our website. We have walk-in appointments available throughout the week. And for 12 to 15-year-olds, we are asking that a parent or guardian either come with the child to consent to the vaccine, or if you're unable to go, you may fill out the consent form ahead of time, but the individual does need to come with an adult to receive the vaccine at one of our clinics. Additionally, there are going to be opportunities at pharmacies, at our healthcare systems, and several pediatricians and family practitioners will also be providing this vaccine. So reach out to your provider. And if you have any questions about your child's health and whether or not this is the right decision for you and your family, I recommend you reach out to your child's pediatrician to have that conversation.
For more information about COVID-19 in Johnson County, visit jocogov.org/coronavirus. You can also subscribe to a daily e-newsletter with the latest data and precautions being taken in the county and state.